Hi, my name is Dr. Paige. I'm here at Total Health and Healing Center with Dr. Bree.
Hi.
She is our new naturopathic doctor. She started back in January. So we're going to kind of chit chat with her today and ask her some questions so you guys can learn a little bit more about her. Thanks for being here.
Yeah, thanks for having me.
So first off, can you kind of give everybody just a little bit of background on like you and your education?
Yeah, I'm from Minnesota and did my undergrad at University of Minnesota Duluth in biology with a minor in chemistry. Was thinking more towards the research realm, so I did some intensives in research. And then I had learned about naturopathic medicine kind of here and there, so I was meeting with a naturopathic doctor and doing some research for her on the side. And then after my bachelor's, I went straight to Washington State at Bastyr University for my doctorate in naturopathic medicine.
Okay, great. Thank you. Okay, so question number one. What is or how is a naturopathic doctor the same as or different than a medical doctor?
That's a good question, and I would say an area of confusion for a lot of people because we're so small in relation to the number of medical doctors.
Sure.
So as naturopathic doctors, we're trained as primary care physicians.
Okay.
In our schooling, we have heavy credit load the first 2 years on the sciences, and the ologies kind of come later. But we have a science board exams into the first 2 years, and then we do clinical rotations with more of the intensive coursework. It's kind of system based, and then we do board or clinical board exams following that. So there's a diversity of training out there, but the CCNME is the accrediting body for naturopathic medical schools.
Okay.
So there are a lot of programs with traditional naturopath style of training, but the accreditation is a little bit different in terms of our governing body's NABNE.
Okay.
But yeah, we have residencies. Residencies are not required as they are for a medical doctor, and they're not as long. So our residencies are going to be 1 or 2 years.
Okay.
I did a 1-year residency in Moorhead, Minnesota, and I encourage them for a lot of naturopathic medical students because it really like gets you the high number of cases, and you
see a lot.
You see a lot. Yep. So I would say, a lot of the foundational stuff is the same. We have anatomy, physiology, biochemistry, all of those, and then a lot more in terms of nutrition.
Okay.
As compared to a medical doctor, and then training in botanicals and safety of botanicals with pharmacology or drugs. And then homeopathy is another modality that we utilize. There's naturopathic hands-on treatments, and then hydrotherapy as well, and physiotherapy devices like cold laser and galvanic are some of the ones that we use.
Wow, very cool. Okay. So what kind of concerns or issues do you help people with?
I like diversity. There are some naturopathic doctors that like to specialize, and I think I like to just be a general family practitioner.
Yeah.
I like to help kids. I like to help, senior citizens and everyone in between. So I'm trained to diagnose and treat both acute and chronic conditions.
Okay.
Commonly, what comes in the door is like digestive issues, hormonal imbalances, like thyroid is a big one.
Yep.
I see a lot of kid stuff or skin stuff in kids.
Okay.
As well as like behavioral or picky eating, things like that. I have a special interest in gut and as well as adjunctive cancer care.
Okay.
So I like supporting patients with cancer from the complementary and alternative medicine standpoint. And just being able to do the escharotic treatments too, I think So if specializing was kind of a thing, I think that's something that a lot of naturopathic doctors don't necessarily do is the oncology piece.
Okay. Cool.
But I love working with, from like hypertension to diabetes and
literally
kind of all of that.
No, that's great.
And then acute stuff, I enjoy being able to help people so they don't have to be on an antibiotic or, a drug to get relief in that acute illness time frame.
Sure. That's awesome. That's something that I appreciate. It's just going to more of the holistic or more natural thing first, trying something like that first before jumping right to the prescription drugs or the drugs that are going to come with a whole, list of side effects and things like that. It's always nice to try and have some other options to do first. So awesome.
Yeah, and our therapeutic order is really like we go up in intervention as is necessary.
Okay.
So if there is a time or place, like in those acute situations, there's probably there's a time where I have to tell them you have to be on an antibiotic.
Yeah.
So that's what we're gonna I can't prescribe it, but I will send you to where you need to go.
You'll refer out. Okay. And that probably kind of leads us right into our next question. How does healing look different with the naturopathic approach compared to what we would think of it with a traditional allopathic or medical doctor, what they would do?
Yeah. So it kind of, I wish I had a visual because it's kind of like a pyramid.
Okay.
Like I said, we go up in intervention as is needed. And the base of that pyramid is the foundations of health. So diet, lifestyle, exercise, hydration. When those things are not in place, then we have to go higher and higher.
Okay.
So it depends on when someone is coming to me, really.
Sure.
If their vitality is really strong, if something's only been going on for a year, the recovery time is going to be a lot faster than if someone's vitality is a lot lower. They're on a handful of medications. Yeah. It just takes a lot more from our toolbox to get the momentum to make the change that, the body needs more help to get that healing vitality up.
Right, sure.
I also talk with people a lot about, we all have, things go out of balance here and there all the time. And our body's designed for survival. So those things are not going to show up right away. Oh, right. It's after years of the same patterns and, the same level of dysfunction that all of a sudden there's symptoms, but it takes time to kind of unearth that. Yeah. And we kind of heal in reverse order of how things appeared. So sometimes when we're on the right track, old stuff can reemerge. And that's really, the body typically has to go through a state of discharge to get back up to health. Okay. And so in the acute setting, that would look like mucus and cough, for example. Sure. Right? If we suppress that, and a fever. If we suppress a fever, then the recovery is going to be delayed typically. Sure. There's times and places that we have to control a fever, but a fever by nature is the body doing what it's supposed to do, to kill off, make it an inhabitable place for the body. Yeah. So within reason, we don't want to block that. Right. So same thing, skin is a channel of discharge, right? Oftentimes we put topical suppressants on it that make it go away on the skin, right? But then that layer, where it's just pushing that layer of dysfunction deeper.
Yep. It's kind of putting the Band-Aid on and covering up what you need to see and you need to actually work through. Okay. You have a lot of things that you mix up for people. I myself have a couple of delicious tasting tinctures from Dr. Bree. What is that all about? And what do you use those for?
So there's a couple things. Right now I have flower essences, Unda numbers, and botanical extracts. Okay. So botanical extracts are going to be tinctures or glycerites. And it's basically extracting the highest medicinal value from those plants rather than taking the whole form of the plant. Sure. There are pros and cons to each method. There's somewhat of a synergy when you take a whole plant versus the constituents. But I love herbs, and I see a lot of good results from herbs and homeopathics. And so I enjoy that as part of my creativity in developing a treatment plan, because, oftentimes there's a supplement for GI focus or a supplement for sleep or so on and so forth.
Yeah.
Whereas if I recognize that a patient needs some liver support, they need some, stomach support, but they also need some nervous system, actions to bring down anxiety.
Right.
Then I can custom blend a medicine that's more individualized to them.
I think that is so cool. That just custom cocktail.
And most of the time they do not taste good. You just adapt. You adapt.
But no, they work really well. They're very, very cool. Okay. Does health insurance cover your services?
No. Unfortunately, because we were so small, it's not advantageous for health insurance companies to have us in network.
Yeah.
HSA, FSA funds do work. Sometimes, I can order blood work and imaging. Sometimes, depending on patient's plan and company, they will reimburse. And I encourage people to reimburse.
Yeah.
There's a lot of people that want to see that change. So I am recently joined the board of the Minnesota Association of Naturopathic Physicians. And I'm trying to reach the public a little bit more, or help be part of that change.
Yeah.
And so I just encourage people, follow the MNANP on Facebook and Instagram. And then they also have ways in which people can get involved to try to make a bigger change.
Yeah.
So meeting with representatives is, what one person can do may seem like such a little thing, but the more that we're coming together and doing that, then that may initiate change at the larger scale for health insurance to be more of an inclusive thing for holistic care.
That'd be great. Great. Is there anything else that we didn't cover, or anything else that you would like people to know?
Good question. Let's see. I would say in terms of assessment, typically what an assessment is going to look like is the first visit it's a lot of time, but we really deep dive, and I like to look at the whole timeline of someone's life and try to figure out okay, what are the main areas the body needs support? Okay. What are the layers of dysfunction that maybe we need to approach? But then also doing some in-house functional tests as part of the first visit. Right. And then typically, depending on what we're looking at, if we're looking at a functional thing, doing some functional tests like stool or hair or blood. If I'm thinking that there's something that we have to work up and there's a potential diagnosis, it's more at the disease level, then that may include more blood work or imaging. Okay. But the big thing is just individualized care. If I don't have a treatment plan for hypertension or a treatment plan for diabetes, I have a person. Right. And if there's 10 people with those same conditions, there are going to be 10 different treatment plans. Yeah. And the evaluation is going to look different too. Yeah. Let's see. Yeah, I think those are the big things. The machinery or the tools that I use can be helpful in say you're working with someone from the PT standpoint on post-injury. Yep. There's some tools that I have that can just help speed up the recovery that matches well with the work that you're doing with them, or for sure. Working on the internal body and controlling inflammation too. Yeah. Need your ears clean. There's all sorts of things.
But that's one of the things I appreciate most about being here is just the cross referrals and shared patients, and just everybody working together, coming together to just get the patient feeling better and able to do what they need to be able to do. So awesome. Well, thank you so much for your time. Thanks for being here. If you have any questions for Dr. Bree, or are curious or want to maybe schedule a visit with her, you can comment below on this video, or you can go to our website at www.total totalhealthandhealing.com. Thank you so much, and I hope you have a great day.
Thank you.